morning, everyone. It's 5 minutes past 8:30, so I think we get started with the session today. Welcome to the session JMP update on Washington schools. How can we accelerate progress to meet the SDGs? Welcoming you on behalf of WHO JMP, WHO UNICEF JMP, UNICEF, GIZ, Splash, London School of Hygiene and Tropical Medicine, and the Swiss Water and Sanitation Consortium. And also welcome to our online participants. So today we have a very full schedule. We'll start with highlights from the 2024 JMP progress update on Washington schools. Then we'll hear from London School of Hygiene and Tropical Medicine on a scoping review of Washington schools' impact in lower middle income countries. And then we're getting a sneak peek of the forthcoming acceleration framework for Washington schools from UNICEF. We'll break for a few Q&A, a short Q&A, and then we get a few country examples of countries that have tried to accelerate WASH in schools and using these 5 pillars that we're going to describe in the acceleration framework. And then hopefully we have time enough for some group work where we want your brains to function and help us understand the bottlenecks and opportunities of implementing this acceleration framework for Washington schools. So objectives of the session is to understand the status of Washington schools and progress needed to meet the SDGs by 2030, understanding the 5 pillars of the acceleration framework, exchange practical lessons from experiences in low and middle income countries, and then we have discussion and document the bottlenecks and opportunities, like I said before. So welcome again, really glad to have you all here in the room, and I'll hand it over to Christy from the JMP to take us through the first session.
Great, thank you so much, Mariah. Thank you all for being here and for the opportunity to share highlights from our most recent report, which, if you're in the room, is on the chairs in some of the front rows. If you're online, or if you just have too many hard documents that you've already picked up so far, we have a QR code coming at the end with a digital copy. I'm presenting on behalf of the whole JMP team. Tom Slaymaker and Rick Johnston are also here today, so you can chat with any of us during coffee breaks and lunch. Okay, so we're going to look at what proportion of schools have basic WASH services as of 2023, our last reporting year. And then we'll see if we're on track to meet the SDGs by 2030. And then we're going to dig a little deeper and try and find some countries that have made rapid progress that we might be able to learn from. So if you have the report in front of you, if you turn to the first or second page, we tried doing our highlights as an infographic for this report, something kind of new. And we'd love to hear your feedback and suggestions for JMP visualization and communication in general. So come find us if there are ways that we can do things to make the data more approachable for your work. So we produce updated estimates for Washington schools every 2 years. Our first report for Washington schools was in 2018, and we had almost 500 national data sources to pull from. Our latest report was released just earlier this year, and we had over 1,400 data sources. So a really big improvement in data availability. And then I want to highlight in the dark blue there, a lot of our sources are coming from regular integrated national monitoring systems through the Ministry of Education, the EMIS. And we saw that data was available for 68% of the global school-age population for drinking water and sanitation, and for 63% of the global school-age population for hygiene. So pretty good data coverage. But we do still see data gaps for urban and rural disaggregation, and we really have limited data for pre-primary. We have much more data for primary and secondary school levels. Okay, for basic drinking water, we have estimates from 138 countries, and we see an improvement from 66% of schools with basic drinking water in 2015, at the start of the SDGs, up to 77% in 2023. But this does mean that 447 million school children still lacked basic drinking water services in their school as of last year. We are seeing really rapid progress in Central and Southern Asia, which is really impressive. Other SDG regions are progressing a little more slowly or totally flatline. We had estimates from 144 countries for basic sanitation services, improving from 68% in 2015 up to 78% in 2023, but still 427 million children did not have basic sanitation services. And we do see some pretty impressive progress trends for some of the SDG regions, particularly Central and Southern Asia, Eastern and Southeastern Asia, and Sub-Saharan Africa is progressing about on average with the global average. We had estimates from 134 countries for basic hygiene. So we went from 58% of schools in 2015 up to 67% of schools in 2023, but 646 million children did not have the very basic service of just water and soap available to wash their hands, to practice hand washing behaviors. So there's a lot of work that we have to do in hygiene. And we do see some SDG regions that are progressing more rapidly. In this case, Sub-Saharan Africa is one of the fastest. So if we pull those together and we project from 2023 out to 2030, we see that globally we're not on track to meet the SDGs. We need to increase our rate of progress 2 times for water and sanitation and 4 times for hygiene. But good news, some countries are on track. So we have some country examples that we can pull from and learn from. So these charts, they can be a little bit confusing, but on the y-axis, we have the annual rate of change, percentage points per year from 2015 to 2030, or 2023. And then on the x-axis, we have the proportion of schools with, in this case, basic drinking water service. So any countries that land in that blue section are on track to meet the SDGs by 2030. And we see that 19 of 53 countries that had trend data available are actually on track to meet the SDGs, which is very promising. And there's some countries making really rapid progress. India, Panama, Serbia, Syria, and Togo all increased more than 5 percentage points every year since 2015. And I want to highlight Benin here because we'll hear an example from Benin today. They've increased threefold. In 2015, 35% of schools had basic drinking water coverage. And then in 2023, it was 66% of schools. And they're really close to getting over that line and being on track to meet the SDGs. So we'll hear about some of the work that's going on in Benin to try and increase that rate of progress. 24 of 51 countries with data are on track to meet the SDGs for sanitation in schools. And again, we see some countries that are progressing super fast, more than 5 percentage points per year in Croatia, Indonesia, the Philippines, Syria, and Senegal. And Senegal's way up there, so they're progressing very quickly. 13 of 38 countries are on track for basic hygiene. And Croatia, Bangladesh, Cambodia, Niger, and Zambia have all achieved more than 5 percentage point improvements per year since 2015. And here I want to highlight Ethiopia. We're going to hear a couple examples of work going on in Ethiopia this morning, and they have improved almost 4 percentage points per year since 2015. They were starting at less than 1% in 2015. And they've already come to over 30% in 2023, but starting at such low coverage, they really have to pull that rate of improvement to a pretty high level. And there's some exciting things that they're starting in Ethiopia that we'll learn about today. For the data geeks out there, if you want to dive into the data, you can download the JMP country files for any of the countries that we have data for. You can look at all of the sources of data that go into the estimates, and those are downloadable from the blue QR code. And then we also have what we call regional snapshots. You can make your own custom figures with whatever countries you work in or that you're interested in, and you can create your own charts in Excel. And that's downloadable from the pink QR code. So we've been focusing on basic services, and as the name implies, they're quite basic. They're not enough to fully meet the human rights to water, sanitation, and hygiene. So there's other services that are very important. We just don't have standardized monitoring across countries. So we try and focus on one of these areas in each of our reports. And for the last one, we focused on menstrual health. So there's a whole chapter in the report that you have on menstrual health. And we tried to look at how many countries had nationally available data on the domains that were published in the priority indicators for girls' menstrual health and hygiene that came out a couple years ago. And we found 30 countries that have national data on at least one of those domains. Many of them were on facilities, on knowledge, so education and materials, and fewer had data on MH impacts like trouble participating in school, discomfort and disorders, and a supportive social environment. But these countries did cover more than 30% of the global school-age population, so we made some preliminary global and regional estimates for MH. So you'll see that around 2 out of 5 schools provide menstrual health education globally, and we estimate that around 1 in 3 schools have bins for menstrual waste in girls' toilets in schools. As a regional example, in sub-Saharan Africa, about 1 in 8 schools provide materials, menstrual materials, either for free or for purchase. But when we dove deeper, we saw that the indicator definitions vary really widely. So we're not necessarily comparing apples to apples. We need to be cautious with how we interpret the data. And we have some work to do on harmonizing and standardizing the measures that we're using. And if you're interested in that, a shameless plug, tomorrow morning we have an MH monitoring session from 8:30 to 10. So come join us for that as well. So quick summary, a lot of countries do have national data for WASH in schools for SDG monitoring. More and more countries have sufficient data that we can actually track progress towards the SDGs with trend data. But based on the data available, we're not on track. We need to improve or accelerate progress, which is going to be the focus of today's discussion. So it works out really well. I'm excited to hear highlights from the upcoming UNICEF framework for acceleration of WASH in schools. It fits perfectly. Some countries are achieving some pretty impressive rates of progress, so we'll hear about what countries are doing to try and improve progress. And then if you don't want to carry that report home, as I mentioned, you can download a digital copy from the QR code that you see on the screen. So thanks so much. Feel free to reach out to us in person or at info@washdata.org. And with that, I am excited to hand it over to Dr. Robert Drabelbis from London School of Hygiene and Tropical Medicine to talk about a recent scoping review.
Thanks, Christy. My name is Robert Drabelbis. I'm with the London School of Hygiene and Tropical Medicine. As Christy said, we're going to talk through some of the highlights of a recent scoping review that we completed on school-based or WINS programs. This might be animated in a way I can't follow. The kind of last comprehensive school-based systematic review was published in 2019. And one thing, if you've looked at any of these systematic reviews, they all kind of go back to the same, I don't know why I'm doing that, the same lines. There's too many outcomes. We can't do any meta-analyses. Nothing can get really pulled together. So we end up with these kind of narrative syntheses. And if we think about this is quite frustrating. A lot of this is because if we want to understand kind of why we're doing school-based WINS program or WINS programming or school-based WASH programming, we need to understand what the impacts of that are if we want to leverage investment. So what we did a comprehensive search. We found 83 studies. There we go. Hold it here. Everything in pink are the studies that were included in a previous scoping review. Everything that's in the various stages of blue, a newer one, and then this animation going very fast. This is the speed up. These are things that have been published since that last comprehensive review. So we have 83 studies that we've published. Here's how they all kind of map out. If you look at this very busy Venn diagram, just with the overlap here. We categorized interventions by whether or not they were looking at water quantity, water quality, sanitation quality, sanitation quantity, anything related to hygiene facilities or hygiene infrastructure, and then finally that green circle over there if they had some component of the intervention related to behavior change. You'll see here lots of overlap, but very small amounts of overlap where these things start working together. So we have a lot of these interventions that are doing maybe 1, 2 of these things, but very few comprehensive interventions that are holistically addressing kind of school water, sanitation, and hygiene. And here's how they kind of map against the outcomes that they're measured against. So we have kind of in the inner circle there, these are the interventions that are water and sanitation interventions, hygiene and infrastructure interventions, or behavior change interventions in the green, mapped to whether they are reporting on health outcomes, health and educational outcomes alone, or other school-based outcomes. So quite a bit of diversity in the data that we have here. So I'll just move on to this one. So across all of these studies, these 93 studies, we found 313 different outcomes that were reported. That's kind of an insanely high number. I can't do the math in my head right now, but that's about 3.5 different outcomes. I did the math. It's about 3.5 different outcomes per study that we're looking at. We divided these into very specific domains here. Studies that were looking at gastrointestinal illness, respiratory illness, other symptomatic illness, parasitic infections, anthropometrics, hydration, other health. Several related to educational outcomes, so those are absence due to specific issues, and finally a bit on the kind of neurocognitive or kind of well-being outcomes. So across these 14 domains, 313 different outcomes that were reported. We wanted to look a little bit closer, and so we started looking at what are the actual unique outcomes that we're reporting here. And we define these by case definition, who the outcome reporter is, so who's providing that data, the metric or the subpopulation that was used for it, and the follow-up period or the aggregation method. And what we found, I think, is pretty shocking. Of the 313 outcomes, 155 were unique outcomes. So that's basically each of these outcomes was only reported on twice. 111, or 72% of the outcomes that we found, were reported exactly one time. So we have all of these different measures that we're collecting across studies, but they're only being used one time and in one specific study. Only 20 outcomes were assessed in over 3 studies, so where we could see kind of between studies how we could make some of those comparisons. So we have this massively fragmented evidence base that underlies our Washington schools. This is just an example of this. This is for something as simple as absence, and this is all-cause absence. So this was collected through roll call and used as a binary data. It was collected through pupil reported, but reported as a count variable. So within this, we have just insane diversity, even as something very simple like absence, something like respiratory illness, insane. This is where I think 14 different ways that people were collecting and reporting on respiratory illness among school-age children. I'm on some of these studies, so I'm as guilty of contributing to this mess as everybody else, but we've got to do a little bit better. And then if we look across kind of back to those domains, the slide's just kind of the number of outcomes specific studies were reporting compared to the number of domains that they were reporting outcomes on. That diagonal line at the bottom would be if for each domain, so respiratory illness, absence, student well-being, if you had one outcome for each of these domains, your study would be along that diagonal line. And what we find is a lot of studies that are doing things like a lot of outcomes across a lot of different domains. So even within the same study, we're reporting on outcomes in 4 or 5 different ways. Or we have just a couple of domains, so something they'll look at respiratory illness, but we're reporting on it in about 4 or 5 different ways in one specific study. So just when we want to understand the impact of WINS interventions, this helps us identify what the effective interventions are in terms of improving student health, student well-being, and in terms of accelerating progress. This can help us inform policy and resource allocation, but the evidence base behind WINS interventions really suffers from too many non-standardized outcomes and outcome measures that differ by the metric, the follow-up, and aggregation period. You can read here, the protocol is the top QR code. The preprint, which I've been told is live, but might not be live right now, is the blue one. If you'd like to go into this, we have a lot of tables and graphs that you can pull from, and it won't be spinning. You can follow at your own pace. So thank you very much. I think I will hand over to Ryan.
Thank you so much. I think that was very insightful, both presentations. I realized I forgot to introduce myself. My name is Marije Broekhuizen. I'm a WASH specialist working with UNICEF at headquarters based in New York, and I lead the agenda on WASH in schools and menstrual health and hygiene. And I'm really glad to present to you today a sneak peek of the upcoming WASH in Schools Acceleration Framework. We're about to launch it. We're just doing a little last final touches on the document, but we didn't want to withhold it from you because it really aligns very well with the presentations that we've seen earlier. It's very clear we need to accelerate in WASH in schools to be able to reach the SDGs by 2030. And I think the momentum is now. There has been a major strategic shift in WINS programming. We've seen we're going from a focus on separate sanitation facilities for girls and boys in schools. We have moved to providing a complete basic WASH package that includes hygiene, that includes behavior change, etc. We've also seen much more across the board advocacy, not just globally, but also at national level with governments, and a shift from providing infrastructure to working at a system level. And I think that is really the key here. And so we've seen if we strengthen the enabling environment for WASH in schools, we will be able to accelerate the implementation of WASH in schools by 2030. Another source which I think is very useful if you look at the enabling environment is the GLASS report. So one of the things that the GLASS report tracks is the WASH finance strategies. If you look at the WASH in schools integration into WASH finance strategy, you'll see that out of 90 countries, only 32 have actually included WASH in schools in their finance strategy. And then out of these countries, only 35 have costed plans with sufficient funds to implement. And only 23% of countries say they have sufficient funding to reach targets. So even if WASH in schools is in a country's WASH finance strategy, the funding would still not be there. And therefore, it is time that we we implement specific activities that target these gaps in the enabling environment. So how do we do that? We follow the UN Water Accelerator Framework. It builds on 5 pillars, and we're going to discuss these 5 pillars in more detail in the presentation, but then also in the group work. And the aim is to clarify the accountabilities for WASH in schools, to ensure every child has a basic WASH in schools, ensure substantial financial investments. We strengthen WINS indicators in national surveys, education monitoring information systems, EMIS. I think it's really aligned to the work that the JMP is doing. Committing resources to develop the capacities of those responsible for WINS, and then support innovation through WASH technologies and programming approaches. So I'll briefly touch upon the 5 pillars and then we'll wrap up. So governance and policy is the first one. It's really important that we have accountabilities clarified for WINS. Is it the Ministry of Education? Is it Ministry of Water, or are they working on this jointly? and have they agreed on who is responsible for what? I think it's very important, not just for the construction, but also for the operation and the maintenance, the behavior change activities, etc. So coordination is important. It's not just only the government, it's not only the UN, it's not only NGOs, civil society, or the school community, it is everyone, and everyone should work in a coordinated manner. And it should be strategic. Like I mentioned, we have WASH finance strategies if there is no WINS included. The same if there is an education policy, but there is no WASH included in the education policy, that's a missed opportunity right there. Looking to finance now. So I spoke about it already. We need to ensure that WASH in schools is included in a country's finance strategy, whether that's a WASH strategy, WASH finance strategy, or an education finance strategy. It could be in both. The point is there needs to be budget allocated, not only for the construction, but also for the operation and the maintenance. And the Ministry of Education ideally should be accountable to increase budget allocations for WASH in schools. But that means they have to work together with Ministry of Planning, Ministry of Finance, etc. So again, the coordination is really important. Other sources of funding are also possible. Private sector, public-private partnerships, equity grants, microfinance, etc. So there's a lot of opportunities there to leverage financing for WASH in schools. Then data and monitoring. I feel we have already spoken about this at length this morning, but just to say government leadership is crucial. We need to ensure that we have all the most important relevant indicators there and that they are harmonized, that they are aligned to the JMP, and specifically making the case here for menstrual health and hygiene. If we do not have harmonized indicators in our EMIS or in our other in our surveys, we won't be able to measure progress. But we also need to make sure government has the capacity to monitor and review the progress and use that data for policy and planning and allocating finance. So capacity development, all stakeholders should have the capacity, technical, financial, logistical, technological, to provide and to sustain WIN services. So it also means we should maybe do a capacity needs assessment in the country to understand who needs what type of capacity. And so it really goes beyond doing a one-off training, as we often do when we say we build capacity. You know, we train the teachers and that's it. So we have to go beyond that. And then lastly, innovation. It's really about modeling and establishing new programming approaches, but also building on existing ones that work. For example, the 3-star approach. It's been tested in many countries. I think there is a joint review by GIZ and UNICEF coming out very soon, where we document some of the lessons learned. It's also an interesting way to collect more data and accelerate at the school level. WASH in school services. Innovation also means we need to look at things like climate change or the pandemic-ready schools. We know COVID closed a lot of schools. How do we deal with something like that if we face another situation? So how can we integrate IPC much better into school settings? Okay, so it doesn't mean we need to go from 0 to 100 in the next few years. We can progress according to the country's context. You've seen also in Christie's presentation, some countries are way ahead and others still have a lot of work to do. So it means we progress along these service ladders for WASH in schools, from no service to limited or basic, from limited to basic or advanced if available in the country. And if a country is already at basic, then ideally we would like to see it progressing to advanced. So how do we monitor? Data is important. We need to understand if countries are able to implement this acceleration framework. So we have listed in the framework a few more process monitoring indicators for each of the pillars. And in the group work, you will also get a handout with these indicators. So I'm not going to go into detail. Yeah. And just to say, the framework is hopefully going to be launched towards the end of the year. This was a sneak peek, and we hope that the group work we're going to do today can give us some insights in is this framework useful? How can we, as a sector, jointly use this framework to accelerate wash in schools? Thank you so much. I'll hand it over to Tom to facilitate the Q&A.
Okay, thank you very much, Mariah, and thanks to our other presenters. We are right on time, which is a good way to start a conference. So we'd like to take a breather now and see if there are any questions for the presenters. We're going to take about 5 minutes for that, and then we're going to hear some country case studies of work that's going on these accelerators, and then we're going to go into some group work to discuss in more detail. So I'm going to open the floor now. If you've got a question, please say your name, ask your question, and if it is to one of the presenters or to all of the presenters. And if there are questions online, maybe, Robert, you could keep track of those as well. But raise your hands if you have a question. I can see one at the back. Oh, in fact, people can come to the microphone in the middle. Even better. Katrina, go ahead.
We're all set up for this. I wanted to ask on the systematic review for Robert, but for others as well, that I think it's an amazing piece of work, and there's a lot of important things to think about in terms of how we refine the indicators. But given that Wash in Schools is not looking at the quality of the service particularly yet, and that we also, we may be measuring systems where we're not looking at water quality for these, and given that we know these kids will be exposed to other diseases at home with poor water, poor sanitation, and other places in their lives, should we really be focusing on some of these health metrics for Wash in Schools, or should we be thinking about the, versus focusing on the quality of the service we're delivering?
Okay, one good question. Let's take a few, and then I'll go back to the presenters. Any more questions? Please come up to the microphone, and then if you speak into the microphone, the people online will also be able to hear.
Good morning. My name is John Akudago, and I come from Habitat for Humanity. I would want to find out whether the situation about wash in schools is only, the data is only coming from developing countries, or there's also a similar situation in the well-advanced countries. And how are they resolving it that we can learn to take back? Thank you.
Good morning, everybody. I'm Shaka Wakabulindi from Pan-African Association of Sanitation Actors. My question is about data systems that are not up to date. How are we gonna address the issue of data in schools? Even in homes, those living in urban and rural, it is still a pressing challenge. Another issue is about capacity development and innovations, and the active involvement of the private sector towards supporting the agenda of SDG 6.2. All along, the conversations have been focused on water, not knowing that poor sanitation in schools and in households where these children live has adverse effect on water quality. So how is that issue going to be addressed after this conference? Thank you so much.
Thank you very much. And maybe we have, there was one here, and then, but maybe you can form a queue at the microphone. Fantastic. Thank you. Look at this.
All right. Thank you very much. I'm Kondwan Chizewisano from Malawi. And my question goes to the UNICEF, the last presenter, about the framework for wash in schools. Is it only focusing on primary schools, or it's also targeting the preschools? Because in most cases, such frameworks, we focus much on the primary school, leaving out the preschool. If the preschools are not included, is there anything that is happening also to include these young children in such kind of frameworks? Thank you.
Hi, my name is John, and I'm with the Martin Center in Global Engineering at the University of Colorado Boulder. And my question is for you, Robert. Great presentation. So you mentioned that the outcomes are so fragmented. And I found that so concerning because we don't have enough data, and now the data we have is really fragmented. Are there any suggestions on how we can make them more standardized? Right, because I work at a research institution, and you might be like, okay, want to look into this and create new outcomes, Is there a way we can try and make things more standardized so that the data becomes more useful? Thank you.
Thank you. And maybe one more from, please go ahead. Two more then. I think you had your hand up as well, and then we'll go back to our presenters.
Thanks. I'm Christina from Helvetas. Christy, you were talking about the trends and how you all think about trends, and I'm just a little curious about that. I think in a lot of water interventions, we see that last kind of 2 to 5% being really difficult to reach. So do you have insights on countries that are really rapidly progressing, if they're able to reach that really hardest percentage, or when we think about trends, are we just being optimistic and thinking they're going to be linear and we're going to get there? So just a little curious about that kind of last mile, if you will.
Good morning. My name is Dr. Om. I work for WaterAid, lead the behavior change portfolio. My question to the JMP colleagues, thanks for the good presentation. Of course, the having hand washing facilities meets one of the preconditions to practice the behavior. My question to you is, of course, with the current rate of progress in schools, we are concluding that, we need to improve by 4 times in order to achieve 2030. The line of communication to the government who actually allocates budget, having this facility doesn't mean that school students will use it. And we have seen significant gap in terms of having facility plus usability. What are the key recommendations from the JMP side when it comes to data? Of course, government refers to JMP, and when it comes to making decisions, they allocate financing against this. If we are saying that only 33% of the schools need to achieve this, that will have influence and impact in terms of how much budget need to be there. Also, the government kind of skewed view on only having facility is we will achieve our goal. So how are we actually communicating these data to the government so that behavior change elements, what matters, is not forgotten? Thank you.
Okay, very good questions. Thank you very much. So I'm just going to flag them. I think some of them are specific to presenters, but feel free to comment on the other questions as well. So one on health metrics and particularly service quality, Robert, I think particularly for you. One on the data availability for high versus middle versus low income. One and a related question on the extent to which data is being updated and can be relied on. The need for further emphasis on sanitation, the extent to which we're dealing with primary versus preschool, for example. How to standardise last 5%, and how our governments are supposed to work with these data when it's only showing facilities and it's not getting to behaviour change and use. So I'm going to go in reverse order, perhaps, to the presenters. So Mariah, do you want to start? And then I'll go to Robert and then to Krista.
Okay, wow. That's a lot. Thank you so much. So I'll focus on the sanitation and the preschool questions. You're absolutely right. We tend to focus on water, but to be honest, I saw there's quite a lot of acceleration in sanitation as well, looking at the recent JMP data, especially when we compare it to the previous report. So there's been a lot of progress there. In the WASH acceleration framework for school WASH, there is a connection made with the sanitation game plan, which is a very similar framework that looks how can we accelerate sanitation to also reach the SDGs by 2030. And I think the idea is, can we not just look only at schools, but look at the wider communities when we do WASH? So it is about area-wide sanitation, looking at the entire sanitation service chain and integrating the school in that. So I think that is really the key. Let's look beyond schools, let's look at the entire communities and the institutions within that school, including healthcare facilities, and then work with the government to reach area-wide sanitation and look at safely managed sanitation using acceleration frameworks for school WASH, for sanitation. In terms of preschool, very good question. It's often overlooked. When I was working in India, I saw it myself. The challenge is also because another ministry sometimes takes care of the preschools compared to Ministry of Education. and it's not considered a priority, but we can make it one. So my question to you is, what can you do to ensure that preschools are considered for WASH in schools? I think we can apply the acceleration framework specifically to preschools as well. It's just making sure that we have the accountabilities for the government in place, making sure it's included in policies and plans, making sure the finance is allocated, people have the capacity, and we ensure that innovative approaches are there specifically for the preschool setting. So inviting all of you to be part of that. Thank you.
Thanks. I guess kind of first in reference to Katrina's question on kind of service quality versus health impacts, I don't really think it's necessarily needs to be an either or type of situation. We do need to be kind of monitoring and assessing the quality of services that are provided at schools. But I mean, this is a point of disease transmission at schools. It is where children are spending kind of large portions of their lives. Like, I think, of waking hours, they might actually be in the school more than they are in home. So, I mean, understanding the impacts of these interventions, I think, is really critical, and in terms of driving government investment and government policy. In terms of standardizing those indicators, there are quite a few people that are working on that, and I think it's when you get kind of behind things. So I know we have the INS-wise or the institutional-wise scale, which is the experiential scale of how students kind of access these services. Quite a bit of work that's going in there. It's no small feat to develop standard indicators that can be used. There's also the kind of the big consortium consultation that went behind standard indicators for MHM. I think we need a parallel process for a lot of these outcomes as well. And I think we as researchers, it kind of starts with us. We got to do our homework when we're kind of starting a trial, understand what measures are out there, how what we're proposing fits in with things, not just focus on just the indicator, but all of those other aspects. So what's the time period, how we're aggregating that, and who's going to actually provide that data. Working with children is a little bit different, and we can't kind of, we have to make sure we've got the right ways to get this information from the people that need to. So more conversation, more collaboration, and yes, that's the starting point.
Okay, Tom and Rick, feel free to chime in here too. So the first one, high-income countries, great question. So we do have data for a number of high-income countries, and it shows universal coverage, which we say is greater than 99%, which is kind of getting to Christina's question too. A lot of those data do come from UNESCO UIS, the Institute for Statistics. They are the agency responsible for Target 4A, and so we will fill our data gaps with UNESCO UIS data when we don't have a direct primary data source. And what those look like is UNESCO UIS sends a questionnaire to a national government. The national government fills in answers. There aren't always primary data that are sent with it. And then those are reported as part of global monitoring. And for high-income countries, many of those say 100% across the board. And we're not completely sure what the primary data are behind those. So that is a limitation. And I think we really need to push for more WASH in schools monitoring in high-income countries. And we are seeing that for menstrual health. And we do see that things aren't as rosy as you would think. So if you look at the menstrual health data for United Kingdom and the US and Germany that's in the report, we have our struggles too. So I really appreciate that question. I think it's highlighting an important gap. Another one was kind of that last mile. That is a tricky one. And so JMP, we use linear regression, and we've reevaluated that method a few times, and it keeps coming out as the winner. So linear regression it is. And so you do see every time that we produce estimates every 2 years, that linear regression line will change, start and end point. And so we might see a slowdown there. But we have a number of countries that have reached greater than 99%, which we'll call universal coverage. And then the last one was on use. I'm really glad that you brought that up. Yeah, we need services there. That's a foundation. That's a necessity, right? It's necessary but not sufficient for the health impacts that we want. It is the global monitoring indicators because it's something that we can realistically monitor through existing systems. It's pretty straightforward to look at infrastructure and what's present. It's much more complicated to start measuring use. And so my thought there would be, this is actually perfect that Robert is here, because partnering with research institutions is a great place to try and start monitoring more of the use side of things. So great point. Tom, Rick, did you want to add anything? Okay.
All right, very good. So we can continue this discussion. And I'd like to now invite our three presenters to come and give some country case study examples of work that's been ongoing around each of these accelerators that was identified in the framework by Mariah. I'm hoping we have Bubakar from Benin in the room. I thought I saw him earlier. He's not here. Ah, okay. Well then, in that case, we can move to, so we were going to have a presentation from Benin, looking at capacity development and innovation. Maybe we'll have that later if we can find him, but if not, we'll move on to the presentation from Ethiopia, which is about governance and M&E. This one is actually a video recorded by the Ministry of Education. So let me see if I can pull that up. So this is Lavam Abebe from the Ministry of Education in Ethiopia.
Hello everyone, this is Luama Abebe from Ministry of Education Ethiopia. I'm Senior Water Supply Specialist and PME Coordinator for One Wash National Program. This One Wash National Program is a government flagship program that will be implemented between those four sector ministries: education, health, finance, and water ministries. They are signing an MOU agreement to work together, plan together, and execute and evaluate together. There is also a consolidated WASH account, CWA account. 85% donors are allocating their budget to this account, and 50% is coming from the government of Ethiopia as a matching fund. This consolidated WASH account, the 9 donors are allocating at this pool fund mechanism. When it comes to the governance, there is at the national level, at the regional level, and also at the district level, there is a structure, steering committee at the national, at the regional level, and also a technical committee at the national and at the regional level, and also program management unit at the national, at the regional level are available and functional. When you go to the district level, there is a Woreda WASH team. They are implementing all activities at that level closely and harmonizingly. When it comes to the opportunities, what are the opportunities that will be given due to this One Wash National Program? Out of this 100 consolidated WASH account budget, 12% is allocating for institutional WASH, specifically for the school WASH activities, to construct the full WASH package with hardware and software component. So this opportunity is that it helped to focus on the schools dedicating budget specifically for the schools, and also it helped us to fulfill more than 1,400 schools benefited with full WASH package access, and also government of Ethiopia, specifically Ministry of Education, particularly working on the school WASH activities by different programs like New Ethiopian School Initiative and also Generation for Education programs. Those initiatives help us to fulfill the full WASH package at the school level. Those opportunities getting the performance of the student and attendance improving its own parts. Thank you.
Okay, very good. So a nice summary of the One Wash program and the School Wash package in Ethiopia, which is part of the effort to generally improve governance and coordination within the sector in Ethiopia. So staying on the Ethiopia theme, we're going to now hear from Chris Nicoletti, particularly on finance, which is also an accelerator for Washington schools.
Good morning, everybody. First session of UNC. Thank you for being here. My name is Chris Nicoletti. I'm the Chief Impact Officer at Splash. And I'm going to share just a little bit, kind of putting some of these ideas into the world. And also, it was interesting to hear from Ms. Abebe about the One Wash program, because we have been part of that and making that kind of come to fruition within Addis and Bahir Dar in Ethiopia specifically. So at Splash, we work in urban settings, and we take a comprehensive approach to washing schools. So just a quick summary of what we do and what we're talking about. We design and install child-friendly sanitation, hygiene, clean water facilities, as well as work with the entire kind of social ecosystem around kids to deploy MH and hygiene curricula. So we want every school to be the picture of a perfect wash in schools solution, but we work across entire cities in hundreds of schools. And in the case of Addis Ababa, we're in about 575 schools, working in about 97% of government-funded schools in Addis. A little bit of what we've kind of seen as a result of this work is significant coverage across Addis and Bahir Dar, adhering to the national standards for ratios and quality, but also surpassing many of those national standards, as well as significant co-funding from governments as well as other funders, which is what I'll primarily be focusing on in this discussion. Talking about Robert's presentation, we've also achieved a number of impacts that he has helped us to measure, as well as others. Some of these are fragmented and probably one-off outcomes, as he mentioned, but decreases in respiratory illness, increases in girls' self-efficacy, increases in hand-washing behavior, et cetera. So a really promising project operating at pretty significant scale. But specifically about government co-financing, this is kind of the ideal scenario that we all hope to have, is we have a government partner that we can bring in to secure ongoing financing both for capital as well as for operations. So in the case of Addis Ababa and in Ethiopia more broadly, we have been fortunate enough to secure about 25% of the total project cost. It's roughly a $40 million project. Roughly $11 million from government has come into the project over time. I think you could break this into kind of four main chunks. Initially, we had about a $4 million commitment in the form of sanitation block construction happening at schools. I think the key there was that building sanitation facilities at schools was already existing line item in the government's budget, and so it was easier to work with them to boost that budget line. The second one was leveraging existing kind of multilateral funds via a World Bank program through the local water utility, OWASA. They were able to secure, this is the upper right yellow piece, an additional roughly 1.6 million in commitment and ultimately allocation towards construction of sanitation facilities at these schools. In the lower right, the green, midway through project-wise, we realized that because of devaluation in this currency, so the commitments were made in Ethiopian birr, because of inflation and because of devaluation of the birr, these commitments ultimately weren't enough to pay for all of the sanitation blocks at all of the schools. So we had to re-up that commitment and secured an additional 3 million, roughly 3 million. And then in the lower left, we moved into a new city in Bahir Dar. And we, through our experience in Addis, as well as kind of what we could show we could be capable of doing in partnership with the Addis Bureau of Education, we were able to secure about 2 million in Bahir Dar. But the difference there was we knew the critical importance of ongoing operational expenses. And so rather than having just commitments towards CapEx or toilets, we were able to break that into two pieces. So we had a CapEx commitment towards toilet block construction and a 10-year commitment for operational expenses. That's great, and it was amazing, and we were really happy about it. But I think the bigger thing is there's still been challenges. I'm not going to go into a lot of these details because we can talk about it during the breakouts. However, I think a few to call out was the devaluation of the currency and inflation really made it hard to achieve the vision that both Splash and our government partners had, which is 100% coverage of urban schools, and that cost money, and that re-upping those commitments was a challenge. This is all about kind of political will and political capital being able to go into these investments, and so revisiting that discussion year after year is a challenge and something to be thoughtful of. Secondly, with increased conflict across the country, there was a change in prioritization of investments, which then caused trailing kind of allocations to diminish over time. And then maybe the third theme here, which I think is important to consider, has been touched on, and I think is a really big one, which is collaboration. Washington Schools is a nexus topic. It requires the Bureau of Education, Ministries of Health, a Bureau of Construction, if that's the case. And so what SPLASH has done most in our work with the government is coordination. These bodies don't necessarily coordinate as efficiently or as effectively as they could, and so SPLASH has played a big role in coordinating the efforts across these bureaus. I'm just going to take a quick plug to say we have recognized that this is a unique case for SPLASH to have secured a decent amount of money towards a big project. And so we've sunk some resources and partnership into researching how that happened. So probably next week, unfortunately it wasn't this week, but next week, we will have our stakeholder engagement research completed. And really what this is kind of a playbook of what did we learn here and what is the actual process from ideation all the way to securing financial commitments and then coordinating those allocations throughout the course of the project. What are the drivers of that? And really kind of a playbook for us moving forward, but hopefully for you as well. What do we recommend for governments, for civil society, as well as for donors that are coming into this space? And we'll be sharing that both on our website and at future conferences and spaces. But there's been a few really interesting recommendations, which we can talk about in the breakouts as well. So thank you very much. I think I'll hand it back to Tom.
Okay, thank you very much. And maybe we could have a round of applause for the Ministry of Education in Ethiopia as well, so they can hear when they listen back to the recording later. Okay, I'm going to pass over to Rick now, who's going to facilitate the breakouts.
All right, it's time for everyone to do some work. It's been great hearing these great examples and presentations, and I'm particularly excited about this acceleration framework because we all want to accelerate, but it helps having frameworks to understand what are the specific ways in which acceleration can happen. So that's going to be the theme of the breakout groups. We're going to have 5 breakout groups in this room, one for each of the acceleration framework pillars. And then we'll also have a virtual breakout room we've got about 25 people online who are going to get a chance to comment on any of the acceleration frameworks pillars. Now for each of them, you're going to have a little handout in your group. You'll have a facilitator that'll show you what the 5 accelerators are, but within your specific accelerator, it lists the desired results and a short list of the programmatic interventions that have been identified so far in the draft document, which will be finalized soon from UNICEF. And there's also a short list of indicators, 5 or 6 indicators that have also been identified and proposed for that pillar. So we invite you to reflect on that, to note if you think something's missing or should be changed. But more, we'd like you to think about bottlenecks for each of these things, barriers towards acceleration, and opportunities. So we're going to have about 15 minutes for that, and then I'm going to ask each of the groups to come back and report back. Let me invite the governance group. Maria, if you could facilitate the group over in the far corner there. And then we'll have capacity development. Ramesh, if you could join in that corner over there. And then I think for data and monitoring, Christie's the natural facilitator in this corner over here. And Chris just gave an example on finance, so we're going to keep him right here, facilitating finance. And Robert is going to be our online facilitator and sharing back comments and feedback from the online participation audience group. So I think that's 5 groups. Please don't leave. Please go to one of the workshops, one of the breakout groups, and we'll come back in about 15 minutes. Data and monitoring, here you go. Oh yeah, I didn't give you your handouts. There you go.
He's on his way. So can you, I don't know if you want to try and fit it in at the end. Thank you.
There you go.
Okay. Anyways, I'm not going to do it. You said he thought it was for today.
That's a terrible tangle. You okay?
Even more in innovation or governance or capacity development and finance. Don't want to turn anyone off from bidding. A lot of people who are, yes, I'm going to agree.
All right.
Okay.
That's under the Department of Education, but the preschools are under the local government. So if you have the system itself is fragmented, so the data is also fragmented. And in my country, people think it's a burden to give data. They will just give you a number to get rid of you. Because I think nobody keeps monitoring. So you go around asking questions about numbers, and they will just give you a number to get rid of you.
And that's interesting to hear because Philippines is like one of the superstars for Washington Schools monitoring. So it's, yeah, there's still challenges for thinking all your
That's, I think that's from the formal Department of Education data. I have worked in gathering the data in my country, so I know it's easier with the Department of Education. Our problem is the preschool because we didn't know where to get the data.
And that's really common. It's not all the Department of Education.
We're talking about
Local government.
I'm going to ask you, how involved are you in trying to get government to watch? Have you been involved?
This is Madan from Nepal. Actually, I would like to challenge this harmonization of the data for different data sources, especially in Nepal, we have this EMI system, which has been operated by the Ministry of Education and Federal level, and we also have this Canvas platform. It is a comprehensive decimal force MI system managed by Department of Water Supply, Ministry of Water Supply. So the challenge after federalization, basically these primary and secondary schools are under local government. However, data can be managed at the federal level. So this updating of the data is a really challenge.
Those are balance and bottlenecks and opportunities out there, Josh.
You can read my poor handwriting, the opportunity, we've got one. These sheets have some that they may want to share.
Other opportunities?
The opportunity, I think, the two opportunities, basically what I hear and what I also do. One, health sector, every country has a health management system, very strong data gathering system on a daily basis. But education is not necessarily at the same level. The opportunity is health sector has introduced the US data quality self-audit as part of their DNA, part of the national immunization program and so forth. Lots of experience within the sector. If you could introduce data quality self-audit tool within not only school but also part of the JMP, because heavily relying on government data. We have the mechanism for data quality self-audit so that it becomes part of the government routine system. We don't need to collect extra government part of the system. That is one. The second one, of course, it could be biased because it links with my previous question on the use. If we could add one or two case studies, very strong case studies in the JMP report, and encourage countries to add one or two very strong subset of the data set from the country itself, beyond the basic service level facility data, that would be great. And one of the indicators for that would be the number of countries validating basic services with its use. Maybe one or two case studies. So that at least people.
Do you have an example?
Yes, we do have examples, yes. Recently we have collected from Madagascar, Tanzania, part of the multi-country zygophilic disease. I have seen huge difference. All the preconditions are there: soap, water, facility. Only 25% is the use of plastic data without which is a huge scam.
So Tracy, how are you feeling
if it's possible at the end, they'll try and sneak you in, but I'm not sure that, so if you have a
Yeah.
chance at the end, understood that.
I think it might be too late, because the group work is not finished until 5 minutes. I'm giving folks a 2-minute warning to come back and share your findings. All right, guys, that was a quick 2 minutes, but it has been 2 minutes. It's always hard to get people to stop breaking out. Breaking out groups are fun. But still, we must go on. Also, we want to make sure that we have a couple minutes left for Babukar to make his intervention, which was delayed from earlier. So I want to just keep you all where you're staying, and I'll go through the 5 groups and ask you to share some of your key reflections on bottlenecks and opportunities, starting with governance.
Hello, so from the governance group, some of our main things that we talked about is that it's very important to expand on the opportunities to connect both national and local governance. There's a lot of national priorities, but in order to really get things done, it needs to connect to the local governments and local authorities that are able to work on the actual distribution of the work being done. We also agreed that there's perhaps a need to update the language of what school-age children means to include preschool rather than having it as a separate entity. We also must not forget the cultural and religious barriers to equity within WINS services and schools, and having the opportunity to expand upon how we can do that. We also agreed that school-led management can be included in that local level where it's not just necessarily local governments, but the actual school-led management of the services can be a good opportunity to engage a lot more of the important stakeholders. It's also important to look at how funding is allocated, and so there's a big importance of cooperation between the governance and finance, and that's pretty much what we talked about. Yeah. Okay.
Thank you, team governance. Yeah, in some ways, governance is the trickiest and the most essential one. I mean, you can achieve huge acceleration even with limited resources if the governance is solid, if you have champions. But of course, it's a lot easier if you have financing too. So, oh, you see what I did there? Who from this group is going to be?
Okay, so we had a pretty interesting conversation, and I think one of the things we highlighted was that we need government involvement, but the issue with government involvement is that they have limited funding. So if you're asking them to commit to a particular project, you're taking it from another bucket, and like, how does that work? And another big gap we highlighted was coordination, and that like there are lots of sectors that we want to get involved. Private sector, government sectors, different civil societies, but then there's that coordination gap, and so like all these groups are working in silos, but then one of the things we can do is to help coordinate all of that effort to improve how financing is coordinated. I think those were major highlights. Yeah.
Thank you, Team Finance. And I'm not coming to you guys next. You thought I was, but I'm not, because I heard the innovation team was discussing about some links with finance, and this last point that you raised about cross-linkages, I think makes a nice transition. So, Team Innovation.
Okay, small but powerful team here. So first we protested, not really protested, but we wanted to, kind of expand the notion of innovation to talk about really about learning and not focus on technologies and everything else, but trying to think about innovation and programming. And that led us a bit to financing, but it was this idea of innovation and how we communicate and who do we communicate with. There was a lot of great data you presented, and that needs to, get into the right hands. We need to get excitement with that, and the stakeholder groups, whether they're funders and donors, whether they're parents, whether they're administrative officials, whether they're policymakers or students, or especially entrepreneurs, they need to be engaged. And so there needs to be a lot of space for innovation in terms of like the dissemination of the messaging and who is accompanying that message, and even like little details about, okay, there's a antimicrobial resistance agenda in here with hand washing, and so the health folks can be involved. But I think the big takeaway was we need to kind of get out of this, kind of toilets and taps and hand washing exclusively, or narrowness, I should say, and think about climate resilience and preparing for the future, and about the broader environment, so people would kind of understand this as something that really is a future program of thinking.
Innovation is not just for taps and toilets. It definitely leads into programming and behavior change and innovative financing solutions, and partnering with different actors But if you partner with different actors, that leads you naturally to questions about capacity development and learning how to speak each other's language and to accelerate these concepts of WASH in schools in different stakeholder partners. So capacity development team, over to you all.
Thank you. So when you talk about capacity building, it's basically support governments to undertake capacity gap and support them to enhance the capacity, to sustain the wins. So for that, in fact, this group is comprised of from few countries like Ghana and Sierra Leone, myself from Nepal. So this is a context-based thing, but it's still, there are some common points like you see UNICEF is taking lead in almost all the countries when it comes to the capacity building of the government institutions. So there's a need to join hands with the UNICEF wherever it is taking lead. And also there is a need to enhance the coordination among NGOs. That is what we see as an opportunity. And then regarding also there are some points like instability that also has kind of clear impact on the implementation of the programs. So mainly the government stability. So what to do to address that? Probably maybe we have to also keep very much close relation with the bureaucrats, technical teams. Even if government changes, that is there, so we can perform. So these are some points that have come up. And another is, the government there's another limitation like, the budget. Whenever we talk about the capacity, let's take an example of monitoring visit to a scheme. So government is joining, but where from the money is coming? So these are some, kind of bottlenecks. So we have to look at these points. And regarding policy and this so mainly the policy part. Again, the UNICEF is taking lead in different countries. So this is important that we have to join hands with the lead organization. And in this paper, there are some difficult acronyms, jargons, like WASBAT. It was a bit difficult to understand what is WASBAT. I'm in WAS since last 30 years, but this BAT is new for me even. So thank you very much.
Thank you. So capacity development, it stretches across the different pillars, certainly into governance and finance. Good to hear the acknowledgement of the leadership role UNICEF has played there, but also to acknowledge that there are some jargony terms with the bottleneck analysis tool and WINS 101. So as this document gets spread more broadly, we need to make sure that it's accessible to all who aren't fully embedded in the acronyms. So let me ask the last group then to briefly summarize so that we can have a couple minutes for Babukar to share the experiences from Terre des Hommes.
Well, speaking of bottlenecks, so we identified some bottlenecks and opportunities in our big and mighty group over here for data. So bottlenecks would be lack of data from preschool settings, and sometimes preschools are managed at a different level than other types of schools. Building capacity to collect data at the local level, but also thinking about the quality of that data. What types of measures are we using? How reliable do we feel they are? And also then thinking about the respondent burden, that schools are often asked to collect lots of types of data and that we need to balance how much data they're being asked to collect and think about how that the implications that has on the quality of the data if people want to just kind of give a number to make the data collection process easier. But thinking about opportunities, integration between departments such as health and education, particularly giving the example that the health sector has some data quality standards that we feel the education sector could really benefit from adopting, and including cases in countries reporting maybe supply and use. So thinking You can have this broader scoping data, but can we also include cases where we have more specific data about use of those facilities in addition to presence or availability? We also talked about triangulating data. So maybe we have observational measures for use or some types of things, but also the user experience is really important. So thinking about student-reported and peer-reported and teacher-reported data. And then also thinking about definitions of terms. So on this student-reported note, what does availability mean to a student versus what does availability mean to JMP, and valuing both those definitions.
Thank you. Wow, we've found some bottlenecks, but also some opportunities. Well done, team, data, and management. We are being reminded that there's a really exciting plenary coming up, so we do need to clear the room soon. But please, if I could invite Babukar from Terre des Hommes to share briefly some experiences from Benin.
Hello, everyone. Excuse me.
Just stay where you are, please. It'll be easier.
Yeah, I'm late because I was confused. I received a message. The session is tomorrow. And I was in my room to prepare in English the session. And, and now I'm obliged to explain without taking my support, and to explain with my own language. It's not clear, but thank you for your patience. And I want to share with you an experience, Blue Schools in Benin. Abubakar Balo, Regional WASH Advisor for the Swiss Water and Sanitation Consortium and Terre des Hommes too. And this experience is about Helvetas Nimdora projects in Benin. Yeah, Swiss Consortium is a group of 8 NGOs that are supporting by Swiss Agency for Development and Cooperation. And we work in 12 countries, and we support 17 projects in Asia and Africa too. So this experience is about how Helvetas Benin was able to support local and governmental authorities to set up Blue Schools, and also to integrate this approach in the curriculum, education curriculum. Yeah. Okay. So the consortium, this area where our projects are, and Benin is here. And the concept of Blue Schools, the key word I can say is learning by doing. And it's a process. We start with schools, helping schools to have access to WASH basics services. And after, we introduce progressively environmental components. And the goal is to support system actors to be strong, to strengthen them, and also to support them to integrate this approach in the curriculum. And with this experience, Helvetas started with just 6 schools. They help local authorities to start with a pilot, I can say. And this pilot in 6 schools was a great success. And after they support local authorities to share the experience with a regional level and also a national level. So they were convinced. Why? Because Helvetas, they support them. They refused to take the lead, but they gave them opportunity to themselves learn and also pilot this approach. And they use students to make advocacy. It's clear, advocacy? Okay, so, and with the evidence, authorities was convinced to try to to check if it's a great approach. It was the case. It was a great success, and now they started to integrate, and they approve this approach, and they organize a great workshop to integrate it in the curriculum, education curriculum. Yeah, and this is a different step they use. They start with a small approach pilot, and after step by step, they did the approbation, and also it took time, 3 years, I think, but now it's a reality. This approach was accepted, and it's, I can say, a good, very good example for the consortium. And now in different countries, we try to replicate the same experience in Mali, Madagascar, and also Niger. Yeah. So I think there are 3 main points I want to share here. It's right, the asset of this approach is students learn by doing, but there are just one challenge. According to teachers, it's required many time, because to make link between theory and practice is not common in Benin context, but it's for them a workload. And also, it's a very good experience for us, for the consortium, to replicate it in another country. Thank you a lot.
Babuka, your English is fine. You didn't need to worry.
Yeah, thank you so much, and I'm very glad we got our 3rd case study to round off the session. So this is just to say thank you very much for a nice session. We wanted to bring together people working on research and evidence, so what is important when it comes to Washington schools, people who work on data and analytics, how do we measure? Which of the things that are important can we actually measure systematically at scale? And then those who are working more on the implementation, on policy and practice to accelerate progress. 3 very nice examples, but I think we've heard from the breakout groups that there are many more examples of great work that's going on, and I think we want to encourage a sharing of that information. We have the Washington Schools Network, which is a very good forum for sharing examples, and one of the key things I think is bringing together the government partners to talk to each other and learn from each other, which is also starting to happen, for example, through the Washington Schools Learning Alliance, where the governments are talking to each other about their monitoring systems and what works and how they can improve. But someone said, UNICEF leads. UNICEF doesn't lead. Government leads, and UNICEF and other partners can support. I think we're also seeing an evolution in the discussions around Washington schools. So we're always trying to work across WASH and education with our education counterparts. In the education sector, it's all been about getting kids into school. It's been about getting some basic infrastructure in place. It's about books. It's about taps and toilets. And now it's going beyond getting kids into school, and it's about creating a safe and healthy, secure environment, and it's about learning outcomes. And I think we're seeing a similar evolution in the thinking of Washington schools. It's beyond the facilities, and it's starting to get towards the outcomes and the experiences that the students have. So I think we continue on that journey. We continue to share all of the great work that's going on. But for now, thank you very much for joining the session.
So more copies of the JMP report in the back if anyone wants one. And thanks to our online participants as well.
Who was tasked by bringing that along?